everyone. Welcome to the November 14th, 2022 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, aye, here.
Austin Magnan, I know, is doing the lovely update that like all of us got stuck doing last minute, thanks to Zoom. Oh, there he is. Bill Muller, I don't see on yet, and Jen Maynard.
Jen Maynard here.
All right. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Okay. I see Austin is now with us after the fun of the last minute update. Thank you, Austin. Sorry, didn't expect that to happen for everyone.
Yeah, I had to join on my phone, actually. Just my computer's still updating.
Oh, gosh. Yeah, mine's updating, but I have problems with my video. So I said, well, forget it. I'm going to just jump on and start hosting it so everyone doesn't get stuck wondering why it's not going.
Yeah.
All right. I'd like to open the meeting. Can I get a motion to open the meeting?
Almost. Yes, this is Dan Finn. I'd like to make a motion to open this meeting.
All right, is there a second?
This is Austin Magnan. I will second the motion to open the meeting.
All right, all in favor, roll call.
Dan Finn, aye.
Austin Magnan, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st of 2023 at this point of the remote meeting provisions of Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. Let's see, for this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer because, as we all know, anything that you broadcast could be captured by said recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, I'm just going to cover a few quick ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for any topics. After they conclude their remarks, I'll invite the board members to provide any comments, questions, motions, etc. As always, please identify yourself by name when speaking. Please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate meeting minutes. Any votes on any motions made during this meeting will be conducted by roll call vote. All righty. With that, the first topic on the agenda is the alliance updates. I think Nancy, I don't think we could have anyone, there was a bunch of conflicts and stuff with the alliance in attendance. So I think Nancy, you sent out sometime this afternoon.
I did.
The inspection report for like the latter part of October, we'll say through today.
Right, October 22 through November 14.
All right. They've been busy.
Do you want to read through those? So do you have those?
Does everyone have them
Yeah.
up and available?
Anybody have any questions?
Let's see. That's what I was saying. Anyone have any questions on them versus us?
I just
the list.
This is Dan. I just have one comment. I'm just amazed at how busy they've been.
That's why I'm scrolling and I'm scrolling. I'm like, wow.
And not just this past month and the month before, and I suspect if there were any issues with the food inspections, they would have mentioned them. So apparently there are not some kind of sticky general complaints, but apparently they've been resolved.
Yes, we have no issues with any of these here that are listed, have no issues.
Okay, that's great. Thanks.
I'm assuming the 508-839-9605 number is Bill, because I know it looked like.
Yes, it is. I'm
Okay.
sorry.
It's okay. We've all been having trouble tonight.
Well,
Trying to
it's that
log
I had
on.
to update. Yeah, I had to update my my Zoom software or
Yes,
something.
we all
which
got
I-
surprised by that, I think.
Okay,
I
okay.
know, yeah, and
Okay.
then my video's all screwed up right now on this computer, so I just gave up and said, well, I got through the Zoom invite update, so that was enough for tonight versus holding up the meeting
Yeah.
as host.
Okay. Sorry.
No, no worries. We were just, I saw you were having, it kept on saying connecting to audio, so I figured that was you.
Yeah.
We were just going through the inspection report from the Alliance that Nancy had sent over this afternoon, if anyone had any questions or comments.
No.
All right. All right, so the next topic, the only other topic, is COVID-19 cases, vaccines, and mitigation efforts. All right, latest case counts as of November 11th, Grafton was informed of a total of 3,938 confirmed positive COVID-19 cases since the case tracking started back in early 2020. As we all know, there's probably many more cases that are happening in the community, but people aren't notifying healthcare professionals or the Board of Health when they're testing positive at home. That being said, we're obviously, we're still dealing with COVID and the latest Omicron variant. And now we've got the new XBB variant that's being talked about, along with some other alphabet soup variants that I saw come across earlier today that they're starting to talk more about compared to the Omicron BA.5. So just, it's continuing to evolve as we kind of expected and stuff. And some variants are raising bigger alarms in the healthcare community and scientific community than others are. So we just have to, continue to make sure that people, folks are taking the appropriate precautions, especially right now. It's not only COVID, it's also a earlier and stronger, worse, whatever you want to call it, flu season than we've seen. And on top of it, it's a very bad year for RSV. Which primarily impacts the younger population, the infants and babies, and then the elderly population, some immunocompromised folks. But so it's kind of a triple demic or a tridemic that they're calling it. I know that the hospitals in the area, Boston, et cetera, are, from a pediatric perspective, they're just being inundated with respiratory illnesses right now in the pediatric side of things, let alone adults that are still presenting with COVID or flu, et cetera. So, it's definitely precautions should be continued to be taken, getting vaccinations that are available. There's no vaccination for RSV, but there's the flu vaccine. And we all know there's the COVID vaccine series and then the newer boosters and everything, along with wearing masks indoors, especially in more close quarters or populated areas, and extremely especially if you or your loved ones, people you live with, family members, friends that you're in close contact with, are in the higher risk populations, because some of those populations, whether it be COVID, flu, and RSV, it covers all three. That could cause major concern for those populations. So mask wearing is obviously one of the best protections out there for those groups. Besides, I already mentioned the vaccines for COVID. Does anyone have any questions, comments, et cetera, regarding COVID or flu or RSV, since I kind of lumped them all into one big discussion about precautions?
Well, one of the issues with RSV is the number of pediatric inpatient units have closed.
Yes.
The one in Milford closed several years ago, and even Tufts, I think, recently had closed theirs in Boston. So the capacity to absorb people who have, serious symptoms of RSV is less than what it would have been a few years ago.
Yeah.
Yeah, the only thing I would add to that, Carrie, I think that was a good summary of all the things that are going around right now. But
Yeah, there's a lot of
also-
things going around.
yeah, also mindful that it doesn't feel like it's getting close to winter, but it is, and we're going to be approaching pneumonia season as well. And so folks that are at risk and seniors certainly should be speaking to their providers about obtaining that. It certainly won't, protect people from COVID related pneumonia, but certainly don't want any of those types of things happening as well.
Agreed. No, thank you. Yeah, and I know even I was talking outside of COVID, flu, RSV, pneumonia, et cetera. There was someone whose grandson, who's in a more immunocompromised state, I was talking with him and mentioned RSV just out of concern, knowing the grandson's medical conditions. He's like, oh yeah, we actually, the parents brought him to the ER the week before or something because he was running a high fever. He didn't have any of no coughing or anything like that, but they were obviously concerned that he had a high fever, and they were concerned they had heard about RSV and knew about it and everything. Tested him for whatever they could test it for, and pretty much, thankfully, wasn't popping for COVID, wasn't popping for RSV or anything like that. But pretty much the doctors were like, yeah, besides all of this stuff that's going around, there's other stuff that's going around. They've seen a rash of younger, babies, infants, and children that have some type of virus or something that's not all of the ones that, we've already rambled off, that are having a week-long, spout of fevers. Not enough that it's to the point where they need to be inpatient for most of them, but there's something else that's floating around out there. That's not just the common cold, for example, that's causing,
Right.
lengthy fever in kids. Anything else, anyone? All right. If not, Nancy, there was nothing else that had come up. I haven't seen any correspondence or anything beyond the case counts and the part about the inspections.
There was one that I forwarded. Earlier, Mass Department of Public Health updates
Right.
the public health emergency orders.
Which basically rescinds most of the orders.
Huh.
Right. That's the only correspondence.
All right. Nope, Dan.
Thanks, Karen. Just wanted to mention Nancy had sent an email out today, and I didn't get a chance to respond officially, but apparently there's a woman that's been recently appointed. I don't know if it's through the Worcester Alliance. I think it's probably through Region 2 Central Mass Public Health, named Sarah D, and I can't pronounce her last name, who wants to she's been assigned to Grafton to sort of update and review our EDS plans. And I will, in fact, volunteer to do that survey and to make a plan to meet with her. I'll see if I can talk to Dr. Muller, Bill Muller, to assist me in that,
Yeah.
and put a time together. At this
Be glad
point,
to help, Dan. Yeah.
yeah, at this point, it might be after the holidays. She has to get a couple of meetings together before June. But then Nancy, of course, we're going to be looking for that updated list of contacts of the select board and various other people in the town. If you can keep that in mind, we'll be looking for that when we do get together. So I'll reach out to her and see if, and I'll talk to Bill first, see if we can come up with a time or two that we can get together somehow.
Okay.
She's very familiar with Grafton. We had her years ago when Lois
Okay.
was here.
Oh, good.
They would, yeah, she was here like once a month.
Well, that's good.
That was.
Okay, so anyway, I'm
Yeah.
aware of that, and I'll get on that survey in the next few days or within a week or so.
Appreciate it. All right. Well, let's see, upcoming meetings, December 12th. Then we have January 9th of 23, February 6th, and March 6th. Somehow it's almost Thanksgiving already. All right, well, if
I'm
there's.
not aware of any conflicts. My trustee meeting though ran 3 hours
Ooh.
last month. So
I'm sorry.
actually, I would have been more fun to be in the Board of Health meeting, but
And Bill, is that typically the second Monday of a month, of each month?
no, it's usually like the fourth Monday of the month.
No.
I think it's largely because it's, our fiscal year goes from October 1st to September 30th. So we're in the midst of budgets.
Yep.
And, it's a fiscally challenging environment as a political statement would be.
Yeah,
Yeah.
right,
Yeah.
sure.
Yeah. But, so I'm not aware of any conflicts
Okay.
anyway.
All right. Well, if there is nothing else, then as expected, we figured this one would be pretty quick, but we figured it was worthwhile just knowing that things were starting to ramp up in, continuing to be there for COVID and then ramping up further for flu and RSV. That would be good to get at least, the group together and get it out there.
Sure.
So.
And tick season might be over. So,
Yeah.
I hope
I don't
so.
know. My dog still keeps finding them on him every time he goes outside lately.
I'm kind of
He
on
still
the
gets
fence,
his
guys,
stuff.
too. I don't think we've had like a hard frost yet.
No.
From a
No.
tried and true tick and mosquito season, I
Yeah.
don't think we've had the hard
Could
frost.
be in the-
Now we might have snow come tomorrow night into
Right.
Wednesday.
right, dust your
Yeah.
shovels off.
Or check your, we shouldn't need a snow blower from what they're talking for our area, but yeah.
So if that's the case, I'd like to make a motion to close the fastest meeting ever of the Board of Health.
I second.
All right, roll call vote, everyone.
Dan Finn, aye.
Austin
Bill
Magnet,
Muller.
aye.
Ken Maynard, aye.
Karen Gustowski, Gove, and I.